Good evening, Dr. Chen. I'm Claude, and I like to start off saying that healthcare and technology has come so far, but there is still a minor inconvenience with how people are checked out. Now, imagine having the ability to assess yourself. So, as like a doctor would assess or diagnose an individual, imagine you were able to kind of check yourself out, see what was wrong with yourself, be your own doctor. Now, that'd be pretty cool. I want to introduce dynamic healthcare with self assessment. Now, with dynamic healthcare, it basically means that you are constantly being managed or analyzed, and self assessment obviously means you do it yourself. Now, in the average checkup, there is a routine procedure that happens that all doctors go through for everybody. But depending on age and a bunch of other criteria, you could be treated differently. Typically, uh, possible diseases are checked so they can be treated early. They identify issues that may become medical concerns in the future. They update necessary immunizations and ensure that you're maintaining a healthy diet and exercise routine. These exams are also good for checking cholesterol, blood pressure, blood sugar, and etc. etc. You go, you get your checkup at your local doctor's office, and you're assigned a primary care provider. While checkups are extremely important, people are super reluctant on go to the doctor. Whether it be their they just don't want to, they don't have time, it's inconvenient. They could be because they just maybe they don't want to see what's wrong with them. Maybe they're satisfied with not knowing, which is unbelievably disconcerting. Even with less stringent guidelines, according to sources, people under the age of like 25 shouldn't even need to go to the doctors every year. But still, when they should be going, they still don't. This is a problem. Unhealthy and healthy people alike. So unhealthy people aren't going to the doctors because of this reason, which is horrible. And even healthy people are even like they don't have time, it's inconvenient, etc., etc. Now, with all the reluctant people, the source of like the biggest issue is just trying to get people to go to the doctors, to be healthy. We want people to be healthy. We don't want them to be reluctant. So, my idea was to create an app where it is convenient for people to give the doctor what they want or what they should be getting taken care of. So I created an app that takes data from what you would normally give a doctor at a checkup, and it will send it to the doctor and in an interface where they can see trends, they can see all types of information that you've gathered from this app, and the app would work as though other apps in the app store, say the health kit app, except that it would take the data from health app, compile it so it's useful, and then send it to the doctors, and also give you tips and tricks on how you can get healthier. We can help doctors by helping ourselves. If we are able to submit that data to doctors, they can help see what's actually what's wrong with us, and they can diagnose us that's much easier. Dynamic self-assessment. With my hypothetical app, it will compile the data from the apps on your phone, the health kit app that's provided by Apple on your phone. It would take that data and compare it to baselines set up by your primary care provider. They would be able to see trends and be able to see all this data about your habits, nutrition, everything, even things that we wouldn't be able to think be possible now, like blood tests. Imagine being able to have a portable blood test or a portable oxygen level reader, put it into your app, send it to the doctors, and the doctors be able to monitor you, almost like having a virtual pocket doctor. Now, it would use these baselines. We'd have the dynamic checkup. We'd be able to see what the doctor would be able to see in real time what exactly is happening. They'd be able to look at the stats, be able to give you tips right anywhere. Provides an incredible amount of convenience for the patient and for the doctor. Now, the benefits from this are incredible. It removes that reluctance from the patient. The patient can submit whenever he or she feels like it. All right, hopefully often. It will give the doctors more time for like sickly patients that actually need it, and they'd be able to focus on curing other diseases that they actually have time for with the removal of actually people coming into the clinic. My hopes of aiding the checkup process shouldn't be confused with me trying to remove the checkup process, which I don't want to do. I would like to see a future where someone can just get checked out on their phone and the doctors just say come in when they see necessary. But in the near future, that seems unlikely. But with this app, we can hopefully encourage people to get their health checked out. With the hypothetical out, we can also give doctors more time. And while it may seem impossible to give someone a physical like a physical palpitation or a physical where the person has to be there for the doctor to see him, well, it may be hard to do that, but maybe with future technology we could see that a device that would let the doctors know, and they wouldn't need to palpate them. They wouldn't need to see them in person. Imagine an implantable medical device that sent data to the phone through the app to the doctor. There's been a advanced stethoscope made that would actually be put on the person's heart and would actually listen to it and would actually be able to tell the person that there is an irregular heartbeat, or if you put this advanced stethoscope on the lung, there is a whisper or a crackle that should be checked out. Imagine being able to plug that into your phone and having that data sent immediately to your doctor. Imagine an all-in-one device that could do that. Now, that would be awesome. Thank you for listening to my presentation. I've had a wonderful experience in this class. Thank you so much.